Connecting Arizona. Live from the 12 News studios at 200 East Van Buren. This is 12 News Today.
It doesn't matter how well you eat or how much you exercise. To many of us, cellulite seems impossible to get rid of. But now there's a new type of surgery happening right here in the Valley. Ladies, you're going to want to see this.
Call it the curse of swimsuit season. Cellulite. Diet doesn't really help, neither does logging endless hours at the gym. So enter a brand new FDA-approved procedure called Cellulaze that might finally zap that unwanted fat. How it works is basically a three-step process. First, a doctor threads a laser through a thin cannula and snips the connective tissue. Then the laser melts the fat pockets, and finally it heats the skin from the inside out, which encourages collagen and elastin growth. Dr. Daniel Shapiro is kind enough to join us here this morning. He's going to talk about it. He's been doing this procedure at his Valley practice for about 6 weeks now, right, Doctor?
That's right.
Also, Stacey Barrows just had this done a few weeks ago. So, Stacey, I'm going to start with you. Thank you both, first of all, for coming in. Where did you have this done, and how bad was the cellulite for you?
I had it done on the back of both of my thighs. It was bad enough to where I've had to deal with it for a long time. And
yeah, we have some before pictures of you, but it seemed a little aggressive for morning television, so we opted not to use it. We do have it on our website, though, if you want to go. And thank you very much for being brave enough to share those with us. That's very, very kind of you. Doctor, how is this different than the other treatments for cellulite? I mean, it's a huge business, millions and millions of dollars, and creams and lotions and potions.
Right. This is a big deal because it's the first long-lasting or permanent treatment for cellulite, and basically it addresses the problem. Other things in the past are temporary, like lotions or topical treatments, like there's something called Shape, which is really great, but it's not a long-lasting result. So this anatomically corrects the three things that causes cellulite, and that's the bulges, so it takes down the fat, it it releases the connective tissue that causes the dimpling, and it also tightens the skin, so it really does things directly, so that's a big deal.
This was just FDA approved, and I think that probably is something that raises red flags to people. Right. Should folks be worried?
I don't think so. This was created by plastic surgeons and pretty nerdy scientists, so it was about 4 years in development, and the clinical trials now are showing results at about 3 years, which are really spectacular, so I think it's really a great procedure.
Yeah. Give me an idea of what the healing process was like for you.
I was actually back to work the next day, so just minimally, like just some tenderness and stuff like that, but again, I was back to work the next day.
And compared to how you looked before, how do you feel?
I feel great.
Feel great, and how did it come out? Have you seen yourself in the three-way mirror yet? In the swimsuit
really
shop?
I can tell a difference already. It looks really good.
Yeah, and give me an idea, what's kind of the cost? What's the price point we're talking about here?
It depends upon the areas, and generally a treatment area is about two areas the size of a sheet of paper, 8.5 by 11. And usually it's on both thighs, and that starts between $4,000 and about $5,500.
$4,000 to $5,500, and that's per sheet of paper size?
For two areas,
two
and
of
that's
those.
Done in the office, and people can go home right after.
Oh, that's fantastic. All right, very exciting stuff. Thank you both very much for coming in. Appreciate it. Thanks for the insight, and thank you for being brave this morning and coming in and talking about it. I know it's tough sometimes.